Now, Helen Joseph Hospital in Johannesburg has reported a drastic reduction in trauma patients since the alcohol ban was reintroduced. Now, this Monday, the trauma unit saw far more car accidents, assault and gunshot victims than usual, and it's all thanks to the ban on alcohol sales, apparently. The ban was reintroduced to allow for hospitals to deal with the rising number of COVID-19 cases and, of course, to make space in their ICUs and high care facilities. Let's unpack the story now. We're joined via Zoom by Dr. Carol Lewis, who is a consultant for the Helen Joseph Hospital's emergency department. Dr. Lewis, welcome to the AM Report. Thanks so much for your time this morning. You know, I think our viewers would be forgiven if they're confused about whether there really is this causal link now between a ban on alcohol sales and a reduction in hospital emergency room admissions, but the numbers don't lie.
Yeah, I would agree with you completely. I think it's always difficult to know if there's a causative link. I can certainly say that there's a correlation. So what I can give you is just some background and let you know that what we're seeing. In terms of what we tend to see in the emergency department, we tend to divide it up into how many people are assaulted, how many people are stabbed, the amount of motor vehicle accidents we have, the amount of pedestrian vehicle accidents we have. And usually we see an average of about 400 assaults every month. So that's roughly 100 a week. To give you some context, in the first week in July, we had 94 assaults coming in. This last week, we've had 36. So that's a massive drop in the number of assaults. And we've seen the same with stabbings. We usually see on average about 100 stabbings a month. This last week, this has dropped to 14 stabbings over the week. And again, a significant drop in motor vehicle accidents as well, where usually we average at about 200 motor vehicle accidents every month. This last week, that's dropped to 20 over the week.
Wow. And
then pedestrian vehicle accidents again have dropped from roughly 100 a month down to 7 over the last week. So there's certainly been a dramatic drop in the numbers that we're seeing.
That's incredible. And, you know, for those of us who need this explained to us, what does that mean for an emergency room at any hospital?
So the problem with all the patients that we see, and particularly trauma patients, is that they take up time and space and staffing and expertise. So the average patient who comes in who has, for instance, been stabbed or who has been involved in a motor vehicle accident will need to go for x-rays, probably scans, they may or may need theatre, and they probably will need admission. So if we've got such a dramatic drop in the volume that we're seeing, that means that we're freeing up bed space, we're freeing up space in our x-rays, for our CTs, for admissions into the ward, that we can then focus on other areas. And at the moment, we're inundated with patients coming in with respiratory illnesses, many of whom turn out to be positive for COVID. And it means that we can then redirect our attention, what would usually be placed on trauma, through to these patients who now need our assistance at this stage.
And of course, the other issue that comes to mind is if I am at hospital for something that is not COVID related, am I then increasing my risk of contracting the virus by being there?
So potentially, yes. And I don't think that that's unique to hospitals. I think that any time that you're in an area where you're surrounded by multiple other people, where social distancing is difficult, be that at any gathering. And obviously hospitals, if you've got a number of people in a confined space, you're going to struggle to socially distance. So there is going to be an increased risk to anyone coming into any confined space, and a hospital is just one of those. So potentially, yes.
So, Dr. Lewis, there's some discussion around there isn't a need for an outright ban on alcohol, but rather for it to be more tightly regulated. What's your take on this? If we have, times that you can buy alcohol, curfews, so to speak, when it comes to the purchasing of alcohol, you're someone who deals very closely with Helen Joseph and trauma cases in particular. Is this something that you would be in favor of, given the numbers that you've just told us about?
That's a really difficult one to answer. We noticed that we had a dramatic drop between, looking at the numbers between March and April, when the alcohol ban was initially instituted. And our numbers in terms of trauma cases literally halved. And then when alcohol was reintroduced, but with limited hours, this was going back to June, we were almost back up at the same levels that we were in January and February. So although there were limited hours for sales, and this was quite tightly controlled, it didn't make a difference in terms of trauma numbers. We were back at our normal high baseline. It's difficult to comment. Looking at the numbers, I can certainly say that there's been a big difference with the complete alcohol ban.
I mean, is there another discussion that needs to take place here, and the issue around how much alcohol we consume as South Africans, one, and why that needs to lead to assaults, stabbings, car accidents? Is there a whole other discussion around what we need to do as a country when it comes to how we consume alcohol?
Without a doubt. I think South Africa has got vast numbers of patients who present to their hospitals with interpersonal violence. And we think a lot of that is correlated to high alcohol usage. I think the challenge is, what can you fix in the immediate future just to try and relieve the burden with the incoming pressure of COVID patients? So without a doubt, that's a conversation that needs to happen. But whether or not that could happen quickly enough to be effective to try and relieve the burden in the hospitals right now is debatable. Yeah. And I think at the moment, the complete alcohol ban has done what it's needed to do in terms of reducing numbers. Yeah. You'd ideally hope that there would be a better way of doing that, but I'm not sure if that's feasible in the immediate future and with the timeframes that we're looking at.
Yeah, and we certainly can't afford it right now when we need all of the hospital beds available for COVID-19 patients.
Exactly, and a combination of hospital beds, but also staffing, because it's the same doctors that are treating the trauma patients and treating respiratory patients, COVID patients. So your doctors are then being tied or torn between treating two different types of patients. Yeah. And if you can free up the manpower that would usually be dealing with trauma and redirect that onto COVID, it means that your resources are better utilized at the moment, given that we're dealing with such high numbers of COVID patients.
Yeah, absolutely. Some really, really interesting insights there. Dr. Lewis, thanks so much for your time this morning on the AM report. That's Dr. Carol Lewis. He is a consultant for Helen Joseph Hospital for the emergency department there at that hospital in Johannesburg. The numbers tell a completely different story when we look at the debate around the causal link between alcohol abuse and the cases we're seeing in our trauma units. Assaults down from 100 to 36, that's in the week that alcohol was banned again. Car accidents down from 200 to 20. Pedestrian accidents down from 100 to 7. Those numbers don't lie.